Okay, let's start unpacking this then. Before you even, start Googling new doctors or thinking about paperwork,
Right.
the absolute first step, the foundation, really, if you have concerns, is just open, direct communication. Talk to your current provider.
Yes. It's not about starting a fight or anything.
No, not at all.
It's about trying to see if you can bridge whatever gap might be there.
So what's the main goal of that conversation?
The primary purpose is really just to express yourself clearly. Share what you'd prefer in terms of your care. Voice the specific things that are worrying you. Talk about your anxieties. Maybe ask about things you've read online or heard from friends.
Could be anything, right? And it has to work both ways, doesn't it? For it to be actually useful.
Oh, absolutely. Your provider needs to be willing and have the space to explain their side, too, their approach.
They should be able to tell you why they do things a certain way.
Exactly. The rationale behind their standard practices, why they recommend certain tests, how they usually handle specific scenarios. It's their opportunity to give you their medical perspective, share their experience.
So you explain your preferences. Maybe they come from things that happened before or cultural beliefs or just stuff you've researched.
Or just what feels right for your body, your intuition.
Right. And they explain their reasoning. Your provider might explain something in a way that suddenly makes total sense. Or maybe they're actually open to alternatives you didn't even know are on the table within their practice.
Right. When it works, this conversation can absolutely fix the problem. It can get you both back on the same page and, honestly, make that relationship even stronger.
Okay, but there's always a but.
There is. And this is the really crucial part. If you have this open, honest talk, you lay out your concerns clearly, you explain what you'd prefer, you ask your questions, and afterwards you still feel like you were dismissed or you just feel uncomfortable, or maybe most importantly, you feel like you weren't really heard.
That feeling of not being heard.
That's a big one. If that's how you feel, then looking into other options isn't just, something you could do. It's a completely valid and often really necessary next step for your own peace of mind, your safety, your overall well-being. That feeling is a powerful sign that the trust you need just isn't there.
And that feeling, that's kind of the gateway to talking about these specific signals, the things that strongly suggest, okay, maybe it really is time to start looking for someone else during your pregnancy.
Exactly. And it's good to remember, like you said earlier, this relationship often goes beyond delivery. It stretches into postpartum. So thinking about that longer-term support is important, too.
Yeah, good point. Okay.
The first really significant one is, frankly, receiving poor medical care.
Okay, poor medical care. That can sound a bit vague. How does that actually show up in pregnancy? What are we talking about?
Well, it could look like this. You bring up something significant. Maybe you're having intense, unusual pain. Or perhaps you've noticed a definite change, like a decrease in your baby's normal movements.
Things you're specifically told to watch out for and call about immediately.
Exactly. These aren't minor things. And the red flag isn't just having the symptom, it's how your provider reacts to it.
Right.
If their response is reluctance, they seem hesitant to investigate it, or they're excessively slow in dealing with it, or maybe even they're just outright unwilling to provide the necessary care or evaluation for these serious concerns. That's a huge problem. Because during pregnancy, your provider is essentially your safety net, right? You're relying on their medical judgment, their responsiveness to protect both you and your baby.
Oh, yeah.
So any hesitation or failure on their part to act promptly when there's a potentially serious symptom, well, that can have direct negative consequences for safety, for both of you.
You have to know, without a shadow of a doubt, that they're going to take your concerns seriously and check things out thoroughly. Okay, so that's a big one. What's another major red flag?
Another one is when your provider simply doesn't listen or doesn't communicate well.
And those often go together, don't they?
They really, really do. This red flag pops up when you find yourself consistently voicing concerns, things that are bothering you, worries you have about your body, your symptoms, how the pregnancy is going. And those concerns are just routinely dismissed, ignored. You feel like your questions aren't being taken seriously, or maybe you just feel like you're being brushed off. And it's not just about feeling heard, although that's huge. It's also about understanding. You're going to have a million questions during pregnancy, right? About everything from what you should eat, to exercise, to test results, to options for labor. Exactly. If their explanations just leave you feeling lost, that's a major communication breakdown.
And the impact of that goes really deep, doesn't it?
Oh, definitely. When you don't feel listened to and you're not getting clear, understandable communication,
How can you feel confident making decisions?
how can you feel good about all the choices you have to make during pregnancy?
It makes you second guess yourself.
Totally. Pregnancy is a time you absolutely need to be an informed participant in your own care.
Makes perfect sense. Okay, so poor care, poor communication and listening. What's next?
A third red flag, and this one is maybe less about the direct medical interaction and more about the logistics, the reality of actually getting care, and that's limited or basically no availability. It might mean your scheduled appointments get rescheduled frequently, often with very little warning, which makes planning your life around these necessary visits incredibly hard.
Or maybe you get there on time, but the wait time in the office is just excessive.
Exactly. Not just, running 10, 15 minutes late, which happens, but consistently pushing your appointment back by 30 minutes, 45 an hour, or even more every single time.
And look, we all get that emergencies happen in medicine, schedules can get thrown off sometimes.
Of course.
Yeah.
But if it's consistent, if it's excessive delays almost every visit, that points to a bigger systemic issue within the practice. Like maybe they're overbooked or just not managing their schedule well. Pregnancy already comes with its own stresses and worries. Adding the extra burden of unreliable scheduling, sitting for hours in an uncomfortable waiting room when you might feel sick or just plain uncomfortable,
Yeah.
and then not being able to get timely answers when you have an urgent question. It just adds unnecessary stress and frustration. It really impacts your ability to plan things like work or childcare if you have other kids. It just adds to that mental load.
What about number 4?
The fourth red flag we should talk about involves disagreement on treatment. Now, this one's a bit nuanced because medicine isn't always black and white. There are often multiple valid ways to approach things, and a good provider should discuss options with you.
Right. It's not about them just telling you what to do. It should be a discussion.
Exactly. So this scenario could come up really at any point, maybe when you're trying to conceive, talking about fertility options,
Yeah.
or during pregnancy if a complication comes up, or even postpartum, dealing with recovery.
Okay.
The core issue here is when you encounter a medical problem and there's a specific treatment that you, the patient, are clearly uncomfortable with, or maybe you actively do not want it, but you feel like it's being strongly pushed on you, pressured, maybe even feels like it's being forced.
And what makes that cross the line into being a red flag?
What really elevates it, especially, is when there are other options. Alternative treatments that are medically sound, they're recognized by guidelines, maybe options you are comfortable with, but those alternatives are being dismissed or downplayed by the provider.
Can you give an example of that?
Sure. Let's say you're considered low risk and you're talking about labor options. And maybe the provider is really pushing for an early induction, but there's no clear medical reason for it. And they're kind of dismissing your preference, which is to wait for labor to start on its own.
And waiting is a perfectly safe and reasonable option for you in this scenario.
Exactly. If they dismiss that preference and keep pushing the induction without a strong medical basis, that could be a red flag.
This really touches on something important, doesn't it? Patient autonomy.
Huge. You have a fundamental right to make informed decisions about your own body, about your baby's care,
Yeah.
obviously in consultation with your provider, collaboratively. A doctor should absolutely give you their best medical advice, explain the evidence, share their clinical experience. But if they shift from guiding and informing you to pressuring you into something you don't want, especially when other perfectly acceptable options exist, that crosses a line.
Okay, that makes a lot of sense. So, all right, let's say someone listening has heard these potential red flags. Maybe they've been reflecting on their own situation. Maybe they even tried having that initial conversation and it didn't fix things.
Right.
And based on all that, they feel like, okay, switching providers is the right move for me in my pregnancy. Now what? How do you actually, do that?
Okay, yeah. The how-to. First off, it's just so important to say again, you should feel completely empowered and okay making this decision.
No guilt.
No guilt whatsoever. This is your body we're talking about. It's your baby's health journey. Your voice, your comfort level. The first key thing is, if you're really feeling this way, try not to delay too much.
Listen to your gut.
Yeah. If you feel like your current care team just isn't the right fit, looking into other options and maybe making a switch sooner rather than later can often make the whole process a bit smoother, maybe less stressful.
Why is doing it earlier often easier?
Well, mostly because practices and individual providers often prefer to take on new patients earlier in the pregnancy. A lot of them like to see a new patient for that first intake appointment sometime in the first trimester or, maybe by 20 weeks gestation at the latest, typically.
And why is that?
It just gives them more time to gather your full history, get all the baseline information they need, order any initial tests or maybe the big anatomy scan if it hasn't been done yet. And importantly, it gives them time to actually build that relationship with you over the months that are left.
Okay, but what if you're past 20 weeks? Does that mean it's impossible?
Oh, absolutely not. It definitely does not mean it's impossible. It happens all the time. Think about someone who has to move across the country for a job or even move internationally halfway through their pregnancy.
Right. They have to find someone new.
Exactly. It's totally feasible.
But maybe a bit more complicated.
Potentially. It's just worth knowing that when a practice is thinking about taking on a new patient later on, say in the third trimester, they might look at things a bit more closely. They'll consider why you're switching.
Makes sense.
They'll also look at how far along you are and whether they realistically have the capacity, the appointment slots, the resources to integrate you smoothly into their schedule at that later stage, especially with delivery getting closer. So it might just take a bit more calling around, maybe a slightly longer wait to get that first appointment booked.
Okay, here's something really practical then, especially if you're switching later on.
Yes.
What about your current appointments?
Ah, yes. This is a super crucial practical tip, particularly if you're switching later in pregnancy, but really anytime you're in the process. Do not cancel your scheduled appointments with your current provider until you have actually been seen and formally accepted as a patient by the new doctor or midwife.
That might feel a bit awkward, maybe.
Yeah.
Showing up when you know you're leaving.
It might feel a little weird, yeah. But it's genuinely important to make sure there's no gap in your care. Continuity is key. You don't want to miss anything important while you're transitioning. Getting that first appointment with a new practice can sometimes take several weeks, depending on how busy they are.
So keeping the old appointments ensures you don't miss vital check-ins, blood work, scans during that in-between time.
Precisely. If the current office asks why you're still coming if you're thinking of leaving, you can just simply say you're exploring options for your care. You don't need to go into a whole long explanation.
Okay, good practical advice. What's the next big step in the process?
The second really key step is getting access to your medical records. And this isn't just like a nice thing to have. It's your fundamental right.
You have the right to your records.
Absolutely. At any time for any reason.
So how does that work when you're switching?
The most common way, and often the easiest, is to have your new provider's office request the records directly from your previous provider's office.
Okay, so the new office handles it.
Yeah, that's pretty standard procedure. The new practice will have you sign a medical records release form that gives them written permission to get your files from your old doctor.
And what does that authorize?
It authorizes the transfer of everything, your full history, all the prenatal notes from each visit, lab results, ultrasound reports, any other relevant documents about your pregnancy care up to that point.
Why is that so important?
It ensures your new provider gets the complete picture of your journey so far, which is absolutely essential for them to just pick up where the other provider left off seamlessly.
Okay, but here's something else, kind of a proactive tip maybe.
Go for it.
Is it a good idea to get a copy of your records for yourself, even if you're not switching?
Oh, absolutely. That's a really wise thing to do.
Why is having your own copy such a good idea?
Well, think about it. You'll have a plan, right? A specific hospital or birth center where you intend to deliver. But life happens. You just never know when or where an emergency might strike.
True.
You could go into labor unexpectedly while you're out of town. Or maybe you experience a complication that means you have to go to the nearest hospital, not necessarily your planned one. Or you need urgent care while traveling.
Okay, I see where you're going.
If you end up at a facility that isn't your planned delivery spot, being able to hand them your complete prenatal records right then and there can be incredibly helpful, maybe even life-saving in some situations.
Because they get all the info immediately.
Exactly. Your whole history, any known complications or concerns, your blood type, your Group B strep status, details about previous births, medication allergies, all the key stuff they need to give you the right care quickly without having to wait or guess. It's like a safety net for the unexpected.
How do you usually get that copy?
You just need to request it directly from your provider's office. They might charge a small administrative fee for copying, but it's usually pretty straightforward.
Good to know. Okay, so we've covered recognizing the signs, the practical steps for a full switch.
Mm-hmm.
But what if someone's kind of on the fence? Like maybe they don't think they need to leave the whole practice.
Right. What if the issue is really just with one specific doctor or midwife within a larger group?
Yeah, is that a possibility?
That's a really common situation, actually, and it's definitely worth thinking about. If you generally like the practice itself, maybe the location is super convenient, you really like the nurses or the front desk staff, or the hospital they use is the one you want,
Mm-hmm.
and the problem really feels confined to your interactions with just one specific provider, then yeah, looking into whether you can just stay in the same practice but arrange to see a different doctor or midwife in that group,
Yeah.
that can be a viable option for some people.
It probably feels less disruptive than starting completely fresh somewhere else.
It can, yeah. You might already know the facility, their general way of doing things.
Okay, but I sense another but coming. Is there a catch?
There is a really important caveat here, something to strongly consider, especially with group practices. And that is, most group practices use provider rotations for who's on call. Meaning the doctors and midwives in the group take turns covering things outside of regular office hours. They handle urgent calls after hours, cover weekends, and who is the attending physician on labor and delivery when patients from their practice come in to have their babies.
Okay, I see the potential problem.
Exactly. So even if you carefully arrange it so that every single one of your scheduled prenatal checkups is with Dr. B instead of Dr. A, the one you had issues with,
Mm-hmm.
if you stay within that same practice, there's still a pretty significant chance you could end up interacting with Dr. A again. Well, you have to ask yourself, how strong is my discomfort or lack of trust with that original provider? Is it so significant that I absolutely do not want to interact with them again under any circumstances, especially not during labor or an emergency?
If the answer is yes.
If the answer is yes, and you truly want a completely fresh start without that possibility hanging over you, then looking for a practice somewhere else entirely is probably the necessary path for your own peace of mind and comfort.
But if maybe it wasn't that bad.
Right. If you feel like, okay, I really don't want them for my regular appointments, but I could probably tolerate seeing them on call if I absolutely had to, then maybe staying within the practice and just seeing someone else for your main care could be an option you explore. It really depends on your comfort level with that potential interaction.
Okay, moving beyond the actual doctor relationship,
Yeah.
there are other big practical things to think about when switching.
Oh, absolutely. And one of the biggest ones for most people is insurance.
Yeah, the money side of things. Can't ignore that.
Definitely not. For the vast majority of people, making sure that the new provider you're considering and the hospital or birth center where they deliver are both in-network with your specific health insurance plan is, well, it's non-negotiable. If you get care from an out-of-network provider or facility, your insurance will cover much less or possibly nothing at all, depending on your plan. This can lead to substantially higher out-of-pocket costs for you, potentially thousands or even tens of thousands of dollars.
Yikes. Okay, so how do you check? What's the first step?
The first, usually easiest step is to go online. Visit your insurance company's website. They almost always have a Find a Provider or Provider Directory section.
You can search there.
Yep. You can usually search by the doctor's name, the name of the practice, or filter by their specialty. This should give you a first look at whether they're listed as participating providers in your network. If you have any questions after checking online, if something looks unclear, or honestly, even if it looks clear, but you just want to be 100% certain before you commit,
What should you do?
call your insurance company directly. Find the member services number, usually on the back of your insurance card.
And talk to a real person.
Yes, talk to a representative, and be ready with specific questions.
Is calling especially important for certain types of insurance?
It's always a good idea, but yes, it's probably especially important to double check by phone if you have maybe a smaller, less common insurance carrier. Or if you have certain government insurance plans like Medicaid in some states, or maybe plans that are specific just to one employer or group.
So finding someone in-network who is also taking new patients and fits what you're looking for might just take a bit more digging and careful checking.
Exactly. You might just have fewer options available within that specific network.
Okay, what else needs checking?
Yes. This is the other critical piece that is surprisingly easy to forget, but it's absolutely vital. You need to double check that the hospital or the birth center where your potential new provider actually delivers babies or performs any necessary procedures is also covered and in-network for your insurance plan.
The facility itself.
The facility itself, your doctor could be perfectly in-network, taking your insurance with no problem. But if the hospital building itself, the place where you'll actually have the baby, is out of network for you,
Big bills.
huge bills, you could face enormous unexpected costs for the hospital stay, the labor and delivery room charges, the operating room if you need a C-section, nursery fees, all the related hospital services. It's treated as a separate entity from your doctor's practice, and its network status needs to be confirmed just as carefully as the doctor's.
So call the insurance company again.
Yep. Call them back or ask when you're already on the phone and give them the specific name and address of the hospital or birth center and ask, is hospital name at address an in-network facility for my plan?
Got it. Provider and facility, both crucial.
Oh,
So what's the main takeaway here, the core message through all of this?
I think it really comes down to empowerment. This whole decision, it's ultimately about making sure you feel genuinely supported, that you feel respected, that you feel heard, and that you feel confident in the care you're receiving throughout the whole journey, pregnancy, birth, and postpartum too.
Your comfort, your intuition really matters. Your well-being and your baby's well-being, those have to be the top priorities.